Do you feel forceful thought to do something? Again doing the activity, your thoughts are again forcing you. Obsessive and compulsive disorder. Myself Sukumiii, I am the student of occupational therapy. Obsessive and compulsive disorder. What is obsession and what is compulsion? Obsession is a persistent thought or images or impulse. Our normal thoughts are settled by normal thinking. For example, if you lost a key in your bag, so you check for it. So after checking, you don't see that. So it is a logically it is not there. So your thought is settled after viewing that. If the obsession is present after viewing that, your thought are not settled. Again and again you will you are compelled to watch the bag. Compulsion is the action done to relieve from obsession. If our thought is repeatedly forcing us, so if we do that, our obsession is relieved. But in this obsessive and compulsive disorder, after compulsion, so after the activity is done, again obsession is arising. For example, obsession thought is contamination. If the hand is contaminated, it is obsession thought. What our compulsive activity is cleaning the hand. Okay, let's define what is OCD. Obsessive and compulsive disorder is a chronic, which means it not occur suddenly. So it frequent, gradually arising. The person has uncontrollable reoccurring thoughts, which means obsession, and uncontrollable reoccurring actions or behavior. So behavior or action are all same. So thoughts and actions are uncontrollable and reoccurring again and again occurring. Though it is uncontrollable, she or he has a urge to do the activity. And these obsession and compulsion cause significant impairment in social, occupational, and other important areas of functioning of the person. So these areas are affected, then the person has OCD. Many related disorders are there. Example, trichotillomania. It is a hair pulling disorder. So it is also like the OCD. So many related disorders are there. In our next video, we will see all the related disorders. Now, what is the cause of obsessive and compulsive disorder? First, genetic. So first degree relatives have any OCDs. So then the person have also chance to get the OCD. Or twins. So if the twin brother he have the OCD, then he has also have the chance to get OCD. Then neurotransmitters like serotonin, dopamine, and glutamate. So these are all working in a balanced way. So if there is an imbalance in these neurotransmitters, then the person have chance to get OCD. Neuroanatomical cause. In this, the structure of the brain and function of the brain are affected. So for the OCD patient, so we check for the scan, MRI scan, the structure of the brain. What is said in psychoanalytical theory about OCD? So OCD is a obsession and compulsion, right? So ID is a personality component. So it is a pleasure principle. So it always wants something. So something pleasurable. So it repeatedly gives thoughts to the brain, and ego what to do due to defense mechanism. Ego unconsciously do the activity. So change the thought in the form of activity. So it change the action. So compulsion is done. So obsession and compulsion is done in the ID and the ego. So example, hand washing. It is given in psychoanalytical theory. Then some psychosocial factors. These are all causing the OCD. What are all the psychosocial factors? So emotional neglect, recent object loss. The person lost any object recently, then he has the obsession thoughts. We lost that, so we have to don't lose anymore. So that like obsession thoughts are arising. Fear of abandonment. So I already lost it. So I have don't want to face the abandonment. So the person fear increased and obsession is increased. Childhood abuse, it may be physical, emotional, or sexual abuse, may lead to the OCD. Okay, clinical features of OCD. First, washers. What is their obsession thought? Their body is contaminated. That like they think, and they compulsively doing bathing or washing. He compulsively done the activity, but again obsession is arised. So he repeatedly washing the hands and repeatedly think about the contamination, dirt, germs, and he again washing the hand. This is the washers. Then checkers, obsessional doubt. So door is locked correctly, counting money. So they have doubt in everything. So they check for the lock for 5 or 6 times, and they check money 5 or 6 times. That like they count again and again. So that like they have obsessional doubts. It is called a checkers. In this, their compulsion is to check again and again. Then pure obsession. Pure obsession means they are only the repeated thoughts. The thoughts cannot be implemented as an action, because if the action is done by the person by the compulsion, then he may suffer very lot. So that like obsession. So very negative. It means intrude thoughts, annoying thoughts are arising like that. So washing is a normal, good for health. So it is not problem. So intruding thoughts. So unknowing thoughts are arising and that cannot be implemented by the person. So it is not cannot converted into the actions. Obsessional images, they often feels violent or abnormal sexual practice, that like they imagine like that. So in uneasy movie we see the person feels abnormal violence. So he repeatedly getting thoughts but he don't do action. So it is a repeated obsession only if the action is done. So compulsion, by compulsion the person do the action, it leads to he becomes a criminal. So he don't do, but his obsession is like violence or any abnormal criminal thinking. Obsessional impulses. So in silent place, in silent search, the person is impulsive to laugh or producing a sound. If he saw the child, he impulsive to pinch the child and make an injury to the child. That's like his impulses are arrested, but he don't do, because if he do, it is antisocial. Obsessional ruminations. So simple thing is done in yesterday. So he repeatedly ruminating means reviewing the event again and again. So first from origin to the end. Again start reviewing the event repeatedly and analyzing. It is a obsessional rumination and obsessive flowing. Due to the repeated thoughts, their day-to-day life is slowed down, and he wants symmetry in arranging, balancing. So if we give some blocks to him, so he always arrange in a symmetrical manner, and he do slowly. So his obsession increased his anxiety and decreased his day-to-day performance, and the person have some obsessional thoughts which cannot be implemented as a compulsion. So some thoughts other than what we are saying, so some thoughts are present in her mind or his mind and it can't be done as an action. So if the door is closed or not opened, that like thought come, so he can check his liver is functioning or not functioning, that like doubt is come, so he can't check, but it is obsession. These are all the pure obsession, which means intrusive thoughts that are unknowing, which means it affect himself or the society. For obsessive and compulsive disorder, basal ganglia may enlarged, or in basal ganglia glucose metabolism is increased. How we can diagnose? We can take MRI and CT and we can view the basal ganglia. Or through positron emission tomography, we can conclude the increased glucose metabolism in the basal ganglia. Or using the symptoms, DSM-5 criteria, using correct symptoms, we can diagnose the OCD. What are all the treatment for the OCD? First, psychotherapy. Under psychotherapy, we have psychodynamic therapy, individual psychotherapy, cognitive behavioral therapy, supportive psychotherapy. So these are all the psychotherapy and supportive treatment and pharmacological treatment, electroconvulsive therapy, psychosurgery, self-help and coping strategies are educated. So in psychotherapy, individual therapy or any behavior therapy, so we going to talk with the person about their anxiety, about their fear, about what are all thinking again and again, about what are all doing again and again. So it are openly talked. Then logical and rational thinking are increased to the person, and by pharmacological drugs we can reduce the antidepressant and by using the anti-anxieties we can reduce the anxiety of the person, stop the compulsive actions and gradually reduce the thoughts, repeated thoughts also. Some related disorder are there in the obsessive and compulsion. Example, excoriation disorder, trichotillomania. So more are there.